they're gone, the years are gone, we can't bring it back. But the troubles that was happening with it was quite extreme, do you know.
It was that unknown of when it was going to happen that was every day you come in, it's like, is this going to be the day, is that going to be the day?
I still think we haven't quite been able to process the impact of the pandemic, and particularly those first few weeks, because we had no point of reference whatsoever. You know, those of us that have worked in health and social care for a long period of time, we've never in our career or lifetime experienced anything like a global health pandemic, and particularly for us working in health and social care, the disproportionate impact it had on the people that we work with and for, and the fact that we were key workers, the fact that we needed to continue to come to work, that work environment just changed beyond recognition.
At the start of the pandemic, there was a lot of fear from staff, rightly so, because there was all over the news and we were seeing lots of deaths and stuff, and it was just like there was a counter on the television telling you how many deaths, like a daily and stuff.
You were always a bit scared about taking it home. Yes, we had been informed of how to properly use PPE, and we had our infection control measures in place, which we followed, and that did help us, but you were still always scared taking it home.
From my perspective, I was really keen to look at a way to engage with our staff team to recognise and commemorate their experiences through the COVID-19 pandemic. My initial thoughts were I'd really like to commission a piece of work to create a partnership that would be for the staff, by the staff, led by the staff, and that our role at senior leadership was to make that happen and to fund that project for them, because I really felt it was important that through art.
We've been fortunate enough to secure funding for all 5 residential care homes to do a unique project which will have a legacy in terms of a piece of art that will be unique to each care home. So we've been in a position to work with the Alliance to create this art and to do a number of workshops with our staff, particularly our social care staff in each of the homes, to reflect and look back at their own unique experiences of the last 2.5 years.
So I've been coming in to host little workshops in the daytime and some evenings, so that a few staff can come in at a time, tell them a little bit about it, you know, tell them, you know, to remind them and thank them for everything they do, and that this is a story for them, about them, and they're helping design it as well. And getting them to think about the things that really matter to them, like maybe their favourite colour, a story of their experience, maybe a word that sums up their story, an image they might have for a piece of art. And the idea is to take time to listen to staff, gather those little what matters to me boards in, and give them to our artists who will take time to read them. And Zhu Zhang will then come back with some designs based on the words, the colours, the stories, the poems, the sketches that staff have shared with us.
The pandemic was really difficult for us. Coming to work every day and you were isolated from your own family, because you had to try and protect your family, you were trying to protect yourself. But being in here, we supported each other, and it gave us a lot more strength to come and do our job. Your colleagues, because there were no other people that was in the same position that we were in, and kind of understood how each other felt. So you always had that support coming to work.
Personally, I live alone, so I was isolated throughout the whole pandemic. So this became a family. Really, all my emotional support came from my colleagues, from any grade as well. You know, it wasn't just folk in my little admin team. It was everybody looking after everybody. Cleaners, caterers, handy. A lot of us all just said, you know, how are you doing?
You can't just abandon people that need you, vulnerable people that are depending on you for a service. That's the job you're in. And there was many people like doctors, nurses, even people that were forgotten about, bin men, people that worked in supermarkets. You know, there were so many people that were just expected to get on with it, you know, but we have to. We're needed.
These people need to be helped. They are vulnerable people whereby they can't help themselves. Though that time it was challenging time, but we used to come every day every day to work. I think I never missed a day during COVID time.
I think you never really know within yourself how resilient you can be until you need to be.
I think the most important things is about where they find the resilience. So they find their resilience from their home, also the care home. The care home is also very important for them, and also the mountains, the riverside. That's why I choose those 3 groups of colors for these artworks. They symbolize these 3 places because they find courage, love, and hope and strength from these places.
It's on the painting, so say the word was courage, love, family.
Really, really nice. I really like the first one, the Soundwave one. That's really nice. I like the idea that that'll be hanging. I also like the second one because people weren't allowed out, so that was a big factor definitely for the residents. They like the fact that it's more and more about the colours and the words that people spoke, obviously. For the residents, the families to come in and see that was kind of our interpretation of our journey throughout COVID. I think it's a really positive thing. It'll be really, really nice.
Particularly in care homes and also some of our inpatient setting, but care homes is built on recreating for our older people that experience of home and making it as homely as possible and making it somewhere where family come, where it's busy. And we went from that in our care homes to a place where people came to work in scrubs and PPE, family weren't allowed in.
COVID essentially dropped a full-time job on top of people who are already doing a full-time job, so the reporting, the extra work in order to keep people safe and continue to live a meaningful life throughout that, the exceptional lengths that people went to help our residents stay engaged, continue to keep them as social as possible, give them opportunities to socialise and to give them meaningful activity to do as well.
We do different, like that's a thing that started during COVID, like Tuesday treats. So on a Tuesday night, like they just get something special. Like it might just be a chocolate biscuit or something. We try and we call it Tuesday treats and, try and make excitement and, just for something extra to make things a little bit happier, I suppose,
If you think of the world, I think we've turned 360 degrees in terms of the use of technology in our care homes, and not everything needs to be face-to-face. And one of the ideas that we thought was a really good one is you could beam live into all 5 care homes, gym stations. So for very little cost, we were able to bring that expertise into our care homes, and it's been really positive because movement and activity is part of the health and well-being of our residents. We know it makes a difference, and it certainly was quite a fun activity for our staff to be involved in as well.
So how do we include our residents and our staff digitally as well? And there was a significant shortfall there. So we worked extremely hard to bring technological solutions to challenges, helping our residents, because for a long time their families could not visit. So how did we keep people feeling connected?
The hardest part as well was watching the families not being able to interact with their family members. I've learned to appreciate watching the residents with their families and get excited with them when they know that they're visiting. Just simple wee things like getting their clothes all ready for the next day, what they want to wear for their families visiting, so as they feel nice, they feel good in themselves. Appreciating them having that human contact with them.
That was a bit, that struck the world, It wasn't just Scotland, the UK, it was the world. It knocked off its feet and we got through it. And I don't think there's been anything like that in a long time. So we can, as a team, we get through anything.
As I say, we became like kind of the COVID family, where we were there for each other all the time. Days off, we'd be phoning each other, "Are you okay? How are you feeling?" If you need somebody to talk to, we kind of just came together and looked after each other.
And it's been fantastic to watch that grow, and it's grown through a circumstance of which we had no control, but as we move into this post-COVID landscape, you see this being retained, that people aren't reverting back to what was a pre-COVID working culture. The culture's changed, and it's not changed from the top, it's changed from the bottom up, which I think is really, really important as well.
I think now we're more stronger, and I think we can accomplish things together as a team, and we're more brave. Like personally, I think I can do everything now. Going through that hard time.
And I think it just gives staff inspiration when they come in. Just seeing it hanging there, the light reflecting on it, the colours, it'll just make you smile when you come in and just give you that kind of perk you up even before you've said anything to anybody.
It's a visual thing, you know, that'll take you back, you know, you'll look at that and you'll reflect, you know, we can achieve things here, we can maintain a level of care and happiness amongst the residents while this is all going round in the background, and try and keep that as a background for them. Let's do as much as we can, so that's what this piece of artwork will remind me of, all the positive things that we did. I'm looking forward to looking at it every morning, put it that way, and just I'll give it a nod now and again, you know, to go, yeah, we done it, we achieved, and I think we did.